The iliotibial band, also known as the iliotibial tract, or simply the IT band, is a markedly thickened portion of the fascia that wraps the entire thigh. The IT band extends from above the hip joint to below the knee joint and acts as a tendon of attachment for the glute max muscle from the back side and the tensor fascia lata muscle from the front side. The IT band broadly inserts into the side of the knee, where it can cause considerable lateral thigh and knee pain when overly tight, called iliotibial band syndrome. The IT band and the muscles that attach to it can be worked using the foam roller, but it is also important to perform other stretches and exercises to resolve an IT band syndrome. To stretch the IT band, roll the lateral side of the thigh from just below the hip joint to just above the knee. It is not recommended that you cross the hip or knee joint with the roller while on your side. Then shift your weight onto the back side of your outer thigh and roll at and above the hip joint along the glute max attachment. Finally, shift your weight more onto the front of your outer thigh and roll the upper thigh at and above the hip joint along the tensor fascia lata attachment. You can stretch the IT band and connecting muscles by performing a standing stretch with your weight shifted onto your back leg. Hold for about 30 seconds. It is also important to exercise the abductor muscles of the thigh for IT band syndrome. The clamshell exercise is safe and effective when performed carefully and with good form. Work your way up to 15 repetitions or so. An elastic strap can be used between the knees to create greater resistance as you get stronger. If the measures presented in this video fail to resolve a tight or painful IT band, you should consult a healthcare professional for formal evaluation and treatment, as myofascial release and gait analysis are sometimes also necessary to resolve an IT band syndrome.